Come with me to have chunks of my cervix removed. Yep, you heard that right. The results from my pap smear came back abnormal, so they scheduled me for a colposcopy about 3 days later. I've had this procedure done once before, so I kind of know what to expect, but that didn't stop me from bringing a friend.
So what is a colposcopy? Why are you being invited? Well, if you went for your cervical screening, your smear test, and you've now had a letter saying you need a colposcopy, it probably means that your HPV, human papillomavirus result was positive, and then there were some changes found in the cells of your cervix. So what does it mean? A colposcopy means having a closer look at your cervix using a special camera called a colposcope. The camera doesn't actually enter your vagina. The doctor or the nurse specialist keeps it outside of the body, but uses it to zoom in on the cervix. Now, being invited for colposcopy doesn't mean that you have cancer. Most people who go for colposcopy don't have any problems, but it's about checking if there are any changes in the cells of the cervix, how significant those changes are, and whether or not you need any treatment for them. So what's going to happen at the appointment? Well, here is how it usually goes. You'll be seen in a hospital outpatient clinic. So it's not surgery, you're not going to need to stay overnight, you're coming to a clinic. You'll be shown into a private room and asked to undress from your waist down, and then you lie back on a couch with your legs supported up. A speculum, which is like the one that was used during your cervical screening, is gently inserted into the vagina so that the nurse or the doctor can identify and hold your cervix. They'll usually aim to hold it just with the speculum alone, and then they'll use the colposcope to have a really close look at your cervix. The colposcope never touches you, it just zooms in. They might apply a liquid to highlight any areas of concern on the cervix. You might feel a little bit of stinging, but it shouldn't be painful. Now, if they do spot any abnormal cells, they might take a tiny sample, a biopsy, which can pinch a little, but it's usually very quick. And you should be able to go home right after the procedure and you'll get your results in a few weeks. The whole thing usually takes about 15 to 30 minutes. But does it hurt? Well, most people say that it's uncomfortable rather than painful, kind of like a smear test, but a little bit longer and potentially with an extra quick test. You might feel a pinch or a stinging sensation if a biopsy is taken. And if you're worried about how that might feel, you should discuss your pain relief options with the team before your procedure. And if you're nervous, it's completely normal. Let the nurse or doctor know. They're there to help to support you so that you can be as relaxed as possible. Did you have to go for colposcopy? Let me know below.